Hypertension, commonly called high blood pressure, is increased pressure that the blood exerts on the wall of an artery, according to the Mayo Clinic. Hypertension affects many Americans today. In fact, the CDC, Centers for Disease Control and Prevention, states that 67 million Americans have hypertension. That calculates to 1 in 3 adult Americans that have the disease. 1 in 5 don't even know that they have the disease. As a nursing student, I have learned much about hypertension and have seen firsthand the harmful effects that high blood pressure has on the body. Today, I will explain the risk factors, diagnosis, complications, and ways to prevent hypertension. Let's begin first by examining the risk factors. The CDC divides the risk factors into 2 main categories: behavioral and hereditary. Hereditary risk factors can't be avoided, but by being aware of them, it will bring awareness to a person about the potential for developing the disease. Family history of hypertension is a major risk factor. It is said that if a first-degree relative has hypertension, then you are at increased risk for also developing the disease. Age is a second risk factor. Blood pressure increases with age. Ethnicity is a third risk factor. African Americans are 2 times more likely to have high blood pressure than Caucasians are. Behavioral choices can contribute to the development or prevention of hypertension. Physical inactivity leads to weight gain, and weight gain leads to hypertension. Failure to exercise is a major risk factor. High intake of salt or caffeine raises risk factors. Many Americans consume way more than the allowed amount of salt each day. Tobacco and alcohol use also place you at risk for hypertension. Stress is a 4th major risk factor. Stress is directly related to blood pressure readings. Because of the prevalence of risk factors in America today, early diagnosis is possible. Often called a silent disease, hypertension may not present with any symptoms. A person may not even know when their blood pressure is high. Some people may have a headache, dizziness, or be lightheaded, but like I said, you may not even know if your blood pressure is high, so it is very important to get your blood pressure checked regularly. To get your blood pressure checked, you can visit your doctor, a local pharmacy, or purchase a device to keep at home so that you can monitor it regularly. Blood pressure is monitored using a blood pressure cuff and a stethoscope. The blood pressure cuff is wrapped around the arm and the stethoscope is placed on the brachial artery. The cuff is inflated and the person taking the blood pressure listens with the stethoscope for when the heartbeat is first heard over the artery. When the heartbeat is first heard, that represents your top number, and your top number is called your systolic number. When the heartbeat disappears on listening, that is your bottom number, and your bottom number is called your systolic number. A normal blood pressure is supposed to be 120/80 or less. If your blood pressure is 140/90 or more, that's considered hypertension. Early diagnosis can decrease the occurrence of serious complications. The University of Maryland Medical Center states that hypertension can result in many complications. One common complication is developing a heart attack. A stroke is a second complication. Chronic hypertension or long-term hypertension can cause damage to your eyes. Hypertension also affects the kidneys, which can eventually lead to kidney disease and kidney failure. Because hypertension is so detrimental to the important organs in your body, prevention is critical. WebMD says that hypertension can be avoided or controlled by behavioral changes. Sodium restriction is one way that can reduce blood pressure. Sodium causes the body to retain water, and water retention causes your blood pressure to increase. Sodium is found in table salt and also many processed foods. Weight reduction and exercise is also a behavioral change that will help with your blood pressure. It is said that if you exercise 30 minutes 3 times a week, that it will help with your blood pressure. Decreased alcohol and smoking cessation are additional aids to control pressure. Relaxation techniques also aid in decreasing your blood pressure. Relaxation techniques may look different for every individual, but sometimes it may mean that you remove yourself from stressful situations. As we have seen, hypertension is prevalent in the United States today. As I mentioned earlier, 1 in 3 Americans have the disease. Today we have looked at risk factors, diagnosis, complications, and ways to prevent hypertension. Lives can be saved and health can be improved by attentiveness to this common disease.